Good morning, good afternoon, good evening. Welcome here in the UK. As you see, I'm not in my usual place. Checking in today with you from Holland at The Hague, as we just finished doing some teaching here. So thank you so much for checking in, because today's topic is about how to use Kinesio Tape to help patients. Because you know that we've been coming off this pandemic that we've the whole world has actually been struggling with, but COVID is kind of coming back. We're in the winter now. What's winter in the UK and Europe? November, winter. Do we know if it's flu? Do we know if it's COVID? Whatever it may be, there is still breathing difficulties. And the real question is, what can we do with Kinesio Tape to actually improve these breathing difficulties? Because just think about it. When you see patients, because you may be thinking, oh, is this actually in my scope? But I mean, if you're like a physiotherapist or a doctor or even a chiropractor, and actually, or an osteopath, you're looking at how can I improve like the movement, the mechanical movement, to really help these patients not only get more air in, because get the oxygen in, but get the CO2 out, but also if there's any other like phlegm, or if there's any fluid that's actually stuck in the lungs, can you help mobilize that too? Because just think about it. If a patient's really struggling with an effect on the rest of the system, maybe it changes how mobile they can be, maybe it changes how hard they can exercise, maybe it changes in terms of what they're confident to do. Well, maybe it's something we need to actually address, because the truth of the matter is that when someone isn't breathing well, they're actually not going to want to move very much. They're probably going to want to sit, or they're going to want to lay down more, just because it's hard work. I mean, if I asked you, if you ever think of a time when you had to do a task, or you had to work, and you kind of go, oh, I'm actually a bit under the weather. And because I'm under the weather, I can't really breathe very well. Did you struggle? Did you really go to work? I mean, I'm really excited to go to work because I can't breathe very well. No, not really. Because now these patients who have difficulties, we think, okay, what can we do to help them? Because they are not only not getting enough oxygen in their body, not getting enough mobility in their body, not getting enough confidence to do anything. They're just in this vicious cycle of getting from bad to worse. So these are the things that we can do with Kinesio Tape, because ultimately you think, okay, if they are not expanding enough, well, actually, what's the main muscle that helps with our breathing? Primary muscle is the diaphragm. And if we are using the diaphragm, and that can, of course, getting we call it abdominal breathing working, we're going to be bringing in more air into the lungs and then allowing a more efficient mechanism of breathing. So there are actually ways to, we call it facilitate the diaphragm muscle. And to facilitate this, because sometimes on some people, the diaphragm muscle just doesn't contract very well. And if we can actually stimulate the muscle with the right direction, with the right tension of the tape, then actually allows it to contract better. When it contracts better, and then it can relax. So it can go through its full range of movement to then change, we call it the lung volumes. But also we have to think about, what about the other muscles? We call it intercostal muscles, and that's why we call it chest breathing, when you're breathing actually at the apical lobes. And chest breathing, these are the people who suck in their tummies and just breathe at the chest. It's not the most efficient way of breathing, but it's still needed as well, because we want to expand as much as possible. So we can actually, if you wanted to create space in the apical lobes, we can actually do web applications to actually create as much lift around apical lobes, just to create that space as well. The next thing, what we can actually do to improve the expansion, is now we need to think about the other structures. What about the bones? What about the cartilage? What about the ligaments? What about the joints? So this is what we can actually do. We can actually tape as well around the sternum, the costochondral junctions, and actually can we get them actually expanding more too, again by creating a lifting effect. Because remember, in Kinesio Tape we have something called convolutions, and if you're not sure what convolutions are, it's basically, we call it the wrinkles in the tape, but essentially the wrinkles in the tape is the lifting mechanism. How can we create more lift? Because if we create more lift from the soft tissue, there'll be more space underneath with the way that the structures may be. But we mustn't just keep focusing just on the front, because we may need to look at the the back, right? Because generally those who struggle with breathing, they're either hyperkyphotic around the thoracic, but if they're hyperkyphotic, they generally don't have a good posture around the lumbar region too, whether it is a lack of lordosis or too much lordosis. But whichever it is, we need to actually get the spine in the right area and the right position to create that ability to expand. So yes, we may need to put Kinesio Tape on the erector spinalis to create more lordosis if they don't have the lordosis in the spine. Because remember, if they get more lordosis, generally